We're often asked, how do we diagnose these arrhythmic problems, these rhythm-related problems that we have in our electrophysiology world? And there's lots of complicated names here, but the tools we use to actually diagnose these problems are fairly simple to start with. A history, talking about the patient's problems, is often the most specific way to go about figuring out what exactly is wrong. Beyond that, we have multiple technological tools at our disposal, the most basic of which is the electrocardiogram, or the EKG. Most of you are familiar with this, where electrodes are applied to the patient's body, and we take a 10-second snippet to see what electrical impulses are flowing across your heart, and we're able to make the diagnosis of what your normal heartbeat is, and sometimes what the abnormal problem is as well. However, some problems do not occur at rest and only occur at certain times of stress, illness, whatever your trigger may be. And for those, we sometimes will use other diagnostic modalities, such as a heart rate monitor or a electrocardiogram monitor, something that might be called a Holter monitor or an event monitor, where you wear these electrodes or a patch for a period of time. And we're able to watch you in the real world as you live your life to see if these problems actually occur. Other possible tools at our disposal include things like a minimally invasive procedure called an electrophysiology study for what we would worry about more life-threatening or dangerous arrhythmias, where we're able to make the diagnosis of what's going wrong in your heart using catheters that we place up the femoral vein, the thigh vein, up to the heart. Lastly, we have implantable monitors that also can be very useful to monitor and or diagnose heart rhythm disorders and problems over time. And these are monitors that we can inject underneath the skin and that can last years at a time to especially diagnose these hard to find arrhythmias that only come and go in a fleeting fashion.